Lumbar spinal stenosis evidence-informed approach to the management. So, you might have patients who would ask that how exactly, they are going to do, depending on what type of line of management that they follow. So the severity of symptoms rather than the dimensions on the MRI would dictate the aggressiveness of the treatment, and the correlation between the spinal anatomy and the symptoms is poor. What do we mean by this? So many times, the patients come to you reading the report that the diameter of the canal has become 6, 5, 4, it should be 12 and 10. So that is not something on the basis of which we dictate the symptoms. Rather than that, what exactly is the clinical picture, whether the patient is having deficit or not, that and correlating that with the amount of stenosis on the MRI film, that is the way in which we decide what type of treatment the patient will undergo. And that is not going to be based on the basis of the size or the dimension of the spinal canal. Surgical treatment offers patients with severe pain and functional improvement more rapid short-term improvement. So basically, surgical treatment you're going to offer to patients who are having a lot of pain, who are in severe pain, in whom you are going to give, who are having functional impairment as well, because this particular line of management gives a rapid short-term improvement vis-a-vis the symptoms. 70% of the patients with stenosis have a favorable untreated or medically treated long-term outcome, and catastrophic neurological complication is rare. Most patients should be offered a trial of medical management. So since catastrophic neurological deterioration is not common in these patients, a trial of medicines is given. With the medicines, we see how are they exactly responding, and on the basis of that we can take a call whenever the patients are having massive disc, very, very big disc. So catastrophic neurological deterioration is something that is common in those patients. However, when we talk about significant stenosis, so you would have a breathing timeline in between, in which you can actually try the conservative line of management to decide what exactly and how exactly it should be managed.